Hey there, good evening, everyone, and welcome back to Revolutionary Health. If you are just joining us for the first time, welcome to Revolutionary Health, and thank you so much for joining us for this conversation. Revolutionary Health is a program of the Counter Narrative Project, and the mission of the Counter Narrative Project is to build power among Black gay men and to work in coalition and solidarity with all movements committed to racial and social justice. You can find us online on Twitter. We're at Building Desire. On Facebook, we're at The Counter Narrative. And on Instagram, on Facebook, we're at The Counter Narrative Project. And on Instagram, we're at The Counter Narrative. Make sure that you visit our website, thecounternarrative.org. There you can join our mailing list, and you really should join it so you can stay in touch with everything happening at the Counter Narrative Project. So, if you're joining us on YouTube, go ahead and hit the subscribe button. If you haven't done so, just do that now. Hit the thumbs up button and let folks know that you are joining us for this conversation. And go ahead and share this video with your family and friends and let them know that you are here with us to have this dialogue. So my name is Johnny Cornegay. I am grateful and honored to be the mobilization director for the Counter Narrative Project. And I am joined with...
My name is David Malebrache, and I am the light-skinned token of this operation. So let's go. Let's do it.
Oh,
I'm ready to represent light skin. We didn't go out in the 80s.
We didn't go
Actually, well, I think we did, actually. I was like this. Actually, I think we did.
We're about to have a really important conversation. So tonight's topic.
Really serious?
I got so serious.
You're like, enough joking around.
Wait a minute, this
We're
is
being
not
serious.
fun. We're serious now.
Right.
We are talking about herpes.
Okay.
So herpes is one of those. First of all, we've heard it come up in pop culture.
Sure.
I remember a couple of years ago, specifically around rumors around folks living with herpes, like Usher and stuff like that. We are not saying that for Revolutionary Health. We're saying that that was something that was in the ether
Right.
A couple of years ago,
Right.
Or in the universe a couple of years ago. And it was one of those things that was kind of happening, but I don't know that I or so many folks had truly had conversations about in the same way about herpes. Like, we understand what HIV is and what all these other sexually transmitted infections are, but that wasn't the same for herpes.
Yeah, herpes is a tough one.
Okay.
It really is. And herpes is a tough one. I could tell you, practicing medicine for like 20 years, stuff like gonorrhea, which is a bacteria, syphilis bacteria, chlamydia bacteria, those are easy things for people to grasp. You get some symptoms, you get a discharge, you get a rash, tests come back positive, you get a shot, get some pills, done.
Okay.
HIV, you get a virus, you get medications, you know what your viral load is, you're trying to get to undetectable. Pretty straightforward.
Yes.
Herpes is one of those things.
Like, herpes is different.
It really is. It's a virus that has no cure.
Okay.
It's a virus that you can get exposed to even when you wear condoms.
Okay.
And even when you don't have symptoms, it can be on your skin, genital herpes in particular, and the virus can actually have what they call subclinical shedding, which means you don't have a rash for herpes, but the virus is still actively reproducing on your skin, and you could actually transmit it to somebody else. I say all those things to say that's what makes herpes a really difficult thing to counsel people on. And to give people advice on, and to tell people that they have. Because even though HIV is a chronic infection or a chronic virus that stays with you for life, there's not that kind of waxing and waning, like you have an outbreak and then you get better and then you break out, and there's no visible things. Like, someone can be living with HIV and you won't know. You see a dick or vagina with herpes, you know because you know what it looks like. So that's what makes it a little difficult to kind of embrace. Not that you want to embrace a virus like herpes, but to kind of accept what's going on.
So is there only one type of herpes? Is that a thing?
There's two types of herpes, two major types, type 1 and type 2 that we talk about.
Okay.
And we used to kind of really just say whether you had type 1 or type 2 herpes. The problem with that was that we would say, okay, type 1 is more of the oral herpes, which are also called fever blisters or cold sores.
I've seen.
So whenever somebody would say to you, oh, it's just a fever blister, it's just a cold sore. No, sis,
that's herpes.
That's actually herpes.
Okay.
And so we would also say that herpes type 2 was the predominant form of genital herpes. We don't do that anymore as much in the medical community because somebody could suck somebody's dick who has type 2
and have type 2 in their mouth.
So that's the thing. Like, mouths go on genitals, genitals go in mouths.
Yes.
So number 1 or number 2, it doesn't matter because they can go in both locations. So it's safer to say oral herpes and genital herpes. The one thing you do want to know is that a lot of times with type 2 herpes or genital herpes, it tends to be a little more aggressive.
Okay.
Particularly genital herpes, once it gets down there, it's just harder. People have more outbreaks. There's more viral shedding. It's harder to kind of treat. And so that can be a little bit difficult. And usually, like, when you talk about herpes, people say, well, how do I know if I have herpes or not?
Yes.
If you have a breakout or if you have a rash, it's going to be red. It's going to be these little blisters or what they call vesicles. So they're kind of like clear fluid.
Okay.
And it starts off as a little rash. It's also very painful.
Okay.
And it's not like a stabbing pain or punching pain. It's almost like it's a nerve pain. So think about it this way. You can get exposed to herpes, and it can be skin to skin. The physiology of it is it goes back to your spinal cord in the middle of your spine. And it can go, your spinal cord goes from your neck all the way down to the crack of your ass, basically. And wherever it is, it follows, like, you think of your spinal cord as one big nerve, and then it branches out into smaller nerves that in your arms and your legs and everything like that. Herpes tends to affect kind of one area with it. And so it'll kind of like affect the mouth, or it'll affect a certain area, and it tends to come back in the same area because it kind of latches onto a nerve. And so when you first have it, sometimes people will have the pain or they'll feel itchy before the rash comes on. Sometimes the rash comes on first. And the difference that makes it different from everything, especially syphilis, is that it's painful. So it hurts. So if you have something, genital area, mouth, that's kind of painful, oral herpes tends to be around the mouth, not inside of the mouth or in the gums, but around the lips, like right here. And if it's painful and it doesn't go away for a few days, you should probably get it checked out.
So
it's a lot. There's a lot to unpack with all this.
It's so much. It's so important because here's the question I have. Is there a way to reduce, I don't like to use the word protect because I don't think it's like about protecting yourself. Is there a way to reduce your chances of coming in contact with herpes?
Well, condoms do help. And so if you wear condoms, that'll protect to a certain amount. But seeing that it's skin to skin, the condom only goes down to the base of the dick. So your scrotum, the inside of your thighs, you can still get herpes that way. And so when I see most people in clinic that come in for herpes, it's usually around the time of a stressful event. And it's either physical stress or emotional stress or a combination of both. So people will describe that they're under a lot of stress, they're not getting enough sleep, they're working too hard, they got a big exam coming up, they just had a breakup, they had a family member die, they lost their job, they're now homeless. All of a sudden it'll break out. And the crazy thing about herpes is that you can't always tell when you got exposed to it based on when you have the breakout. So for instance, you could be 30 years old. You've been having sex since you were 18. You have a new partner at 30. All of a sudden you get a herpes breakout. You can't say definitively that it was that person that you just had sex with. It could have been someone you had sex with when you were 18 and you just didn't know. And so the problem is that it can just stay inside you. And it's not really, I wouldn't call it a carrier state, but I would say you just haven't had physical symptoms because it's hard to tell whether you can actually transmit it or not during that time. Because you just don't know it's on the skin and you can't measure it. The problem is that when if you go into the doctor's office and you say, I want to get tested for STIs.
Yes.
We usually check first. We check. Were you about to ask that question?
No. Yes.
We do gonorrhea, chlamydia, syphilis, and HIV. Herpes is not a recommended
Why not?
screening test. The reason being is that type 1 of herpes, which used to be kind of predominantly oral, in some communities you can find it, if you were to get your blood test, it tests for the proteins or the antibodies that react to herpes. So it's not testing for herpes itself. It's not testing for it's testing for your body's reaction. And your body could have reacted to that from years ago. And also, too, in some communities, up to 60, 70% of people will have a positive test.
Wow.
So you can't tell when you got it, how you got it, how long you had it, or if you're infectious, if you're going to have a breakout, if you're not going to have a breakout. And often one of the things that we tell people, because sometimes we'll screen people and we'll get that blood test and it'll come back positive for either type 1 or type 2 or both, and people freak out.
Right.
I haven't had any symptoms. I haven't done anything. Like, how could I have testing for herpes? How could I test positive for herpes? And what we tell people a lot of times, specifically with type 1, is that you could have kissed your grandmother and your grandmother could have had oral herpes and not know it. And then all of a sudden you got it. So that's like the thing to say, there's a stigma to it, right?
Yes.
So don't like consider yourself dirty or a whore or something really bad, because it's not any of those things. So when we do STI testing as physicians, when you go into a doctor's office and get STI testing, you are not getting tested for herpes, blood test for herpes often. And a lot of people go into a doctor's office and they say, oh, I did an STI screen, everything's good.
Yes. And
they say, what did you get? And they'll say, I don't know, they just told me everything was negative. The message that I give to the audience is find out exactly what tests they're getting. Because typically it's going to be chlamydia, gonorrhea, syphilis, and HIV. It won't be herpes, because the herpes tests that we do are blood tests, and they are antibody tests. What antibodies are proteins that your immune system creates when it's exposed to an infection. And it won't tell you when they started creating those antibodies or how long ago, or predict whether you'll have an outbreak or not. So as I was saying earlier, you could be 30 and you get tested for, I want to get screened for herpes, doc, screen me for herpes. We do the blood test for herpes. It comes back positive for type 2, negative for type 1. Oh my God, this partner that I just had, I know that he or she gave it to me. No, all you know is that you've been exposed at some point in your life, and you may not be able to tell exactly who did it. So that is the most difficult thing about herpes, is that when you have to counsel somebody, especially when they have a blood test, you have to explain to them that in certain communities, the antibody test, the blood test for type 1, up to 60, 70% of the population will come back positive for that. For type 2, it tends to be about 20 to 25% at the highest that I've seen. And so I can't give you the answer. People, well, when did I get exposed? I don't know.
Wow.
How infectious am I? I don't know. Will I have an outbreak this year or next week? I don't know. And so if medical providers are being honest with you when you talk about herpes and you come back with a blood test, that's the problem, is that we can't predict what's going to happen. Now, that being said, if you do have symptoms that you think are herpes, either a rash around the mouth or a rash in your genitals, we do have a culture that we can take. So while you have the rash, if that rash is there, the blisters are there, we can actually scrape the blister, get the fluid, and send it off. If that comes back positive, then you know you have an active outbreak.
Got it.
And all that tells you is that this is a herpes infection that's manifesting itself right that moment.
So, okay. So
it's a lot.
Well, because it's one of those things. So if you have an outbreak, so you can't, there's no cure for herpes.
No. There's medication.
Do you need medication? So there's medication, but when and why would you take the medication?
So there's medication that doesn't treat herpes, but what it does is it reduces the time that it takes for the herpes to go away, for the symptoms to go away. So there's medications, antiviral medications. One's called acyclovir. The one that I use the most often is called valcyclovir. And there's another one called famciclovir. All of those things are really good. So the rule of thumb is that when you have an acute herpes breakout, we usually give people about 7 to 10 days of the antiviral medication. When you notice that rash, and either clinically, I could just look at it and say, that's a herpes rash, or the culture, like if I'm convinced that I look at it and I say, God, that's herpes, I don't have to wait the few days for the culture to come back. I'll just automatically treat somebody with it.
Okay.
Usually the first outbreak is 7 to 10 days.
Okay.
Okay. If you have outbreaks after that, after the first one clears itself, it'll only be about 5 days.
Okay.
And the medication is usually acyclovir 3 times a day, sometimes 5 times a day, depending on the dose. Valcyclovir I like because it's only twice a day. Famciclovir I think is twice a day as well. So when you have an acute outbreak, you can take that. Now, the question is, after you have the acute outbreak, you may talk to your doctor, well, how can I prevent it?
Right.
Like I want to reduce, your question may be, I want to reduce me having outbreaks. This shit hurts.
Right.
It looks horrible. I can't have sex. I don't want to explain this to people. I want to reduce how many outbreaks I have. So what do? Basically, we take the same medication that we use to treat and we use it to do what's called chronic suppression. So for instance, with valcyclovir, which is the medication I like to use when I'm treating folks with herpes, you'll take 1 pill once a day. I think the dose is 1 gram. You take 1 pill once a day, every day.
For
as long as you want to. And so what it does 2 things. And this is proven in a lot of research studies, it prevents you from having the same number or increased number of breakouts.
Okay.
So it reduces the amount of breakouts you have. It reduces the viral shedding on the skin.
So
since it's constantly in your system, it's in the bloodstream, it's in the skin, the virus can't reproduce as much, and then you'll be much less likely to transmit it to your sexual partner. So I've counseled couples before where somebody's herpes type 2 positive and had genital herpes and the other one is negative. And maybe they don't like to wear condoms or they don't wear condoms all the time. What's the risk? And so I have to counsel and say, well, when you use condoms, it's not 100% protective anyway. But what you can do to further help yourself out is that the person who's living with herpes can actually take that medication once a day, not only reduce their number of breakouts, because when you have the breakout and when you have that rash, obviously you're more infectious. There's more virus actually in the rash itself, in those lesions themselves. But you are shedding even when you don't have a rash, so reduce that. And so again, we've talked about sexual health in a lot of different spaces, a lot of different videos on Revolutionary Health. It all depends on communication with your partner.
Yes.
And asking them what they feel comfortable with, what they don't feel comfortable with. I mean, I've had situations where a partner came in and said, okay, I just got diagnosed with herpes. I need to test my partner. And the partner's freaking out like, oh my God, I can't believe you exposed me to herpes. I could have herpes because of you. And then they get tested and they're positive as well. And they already had herpes.
Right.
And so it's kind of one of those things, but it carries a huge, huge stigma with it. And I don't remember the brother's name, but there was someone I got on a podcast with recently. And he came, I would say, out and just disclosed that he was herpes positive. And he has this whole podcast on herpes and brings a lot of people to kind of claim it, not have shame about it, destigmatize it, and say that it's a thing that's very, very common. And so I think it's been looked at as something that's very stigmatizing, like somebody's dirty or someone's a whore just because they got it. And that's not the case at all.
Wow.
Like if you think about it, in some studies, some people will have positive blood tests to herpes, like 20% of the population. For herpes type 1, 60 to 70% of the population. So if you're saying 1 out of every 5 has been exposed at some point in their life, you're saying 1 out of every 5 people is a whore? Like that's just not going to work. It's just a common thing. So I think people have to get educated about herpes, about what it is, about how it's transmitted, and also how common it is. So you can kind of destigmatize or stop judging people who may have been exposed to herpes or may have herpes outbreaks and struggle with that. It's really tough.
So for folks who are going to the doctor's office,
right?
You have to. So what I'm hearing is you have to ask for herpes.
You have to ask, yeah. So if you go to the doctor's office and you want to get tested for herpes, either you're just curious and you want to know kind of what your status is, or you have a partner who's tested positive for herpes and you want to know. You have to specifically ask. Do not assume that we are testing herpes with that. The other thing that I will tell you, and I forgot about this, something you said reminded me, is that herpes as well as syphilis increases the likelihood of contracting HIV.
Really?
And so if you have an active breakout of herpes and you're having sex with someone who is living with HIV, maybe not undetectable, not on their meds, you think about how HIV takes hold in the bloodstream. HIV has to have access into the blood. And so if you have lesions on your skin or irritation that causes some bleeding or access to the bloodstream, and then you have body fluid exchange. HIV can, so they notice most of the studies say that there's like a 5 times increased risk if you are living with herpes, herpes type 2, that you'll contract HIV if you get exposed to it over someone who doesn't have herpes.
Wow.
And so that's something. And the flip happens. So people who are living with HIV are also at increased risk, even if you're undetectable, of acquiring herpes from someone else. So you still have to be careful either way. It's kind of like one of those things that people don't think about or they don't talk about that much. But it's also interesting. The other thing I'd want to mention in this whole discussion about herpes is about the whole criminalization of it.
Thank you.
And so when we talk about the past, like there are 3 examples that come to mind. So there's like Rihanna and Chris Brown. Because I remember, I don't know if y'all saw, like in the social media videos, they would always zoom in on that picture with Chris Brown and Rihanna and say, see that herpes lesion around her? That's why he beat her up, because he said she gave him herpes. And then you remember Michael Vick, who used to play for the Atlanta Falcons, got accused of giving herpes to somebody. And then most recently Usher, like 2 or 3 years ago, got accused of giving herpes to someone. What you need to know is that, right, exactly, like quote unquote, whether they gave it or not.
Right.
So what you know is that when you read these stories, it's always interesting because it'll say the accuser got a blood test and found out that they had herpes or had been exposed to herpes, or they had a breakout and then they want to blame, you know, the celebrity, whoever the celebrity, you gave me herpes. But if you think about what I've just explained to you about herpes,
there's no way to know that.
You have to do some really expensive, rare testing of virus itself, which would have to go to a special lab, cost a whole bunch of money. From the basic labs that you get in your doctor's office, unless you have not had sex with anyone before in your entire life, and this is the only person you've ever had sex with, and even then, you could say, well, maybe I got it from kissing my grandmother, or maybe I got it from that. It's going to be hard to pinpoint that you got it from somebody. And so someone who's in their 30s or their 40s has had a few sexual partners, and then they say, well, Usher gave me herpes. That's going to be a hard sell to prove. The problem is that a lot of the criminalization laws talk about infectious diseases, and so communicable diseases. And so they'll say, and that'll include, and they leave it very broad in general. So it includes HIV, but it also includes herpes. So it'll say, it doesn't matter whether you transferred it to them or not, whether they caught it from you or not. What matters is that you knew you had it and you didn't tell them before you had
Which
sex with them.
Which can't even be proved. That's why these laws are so crazy. No one can.
And no one can prove that. And the crazy thing is that someone could be at 18 years old, get exposed to herpes. Because it's not a routinely screened test, they never check their blood for herpes, never have a breakout. And then they get up to age 27 or 47 or 57, have sex with somebody, that person gets herpes, has a breakout, and then says, you gave me herpes. And you could say, well, I don't have herpes. Yeah, I don't have. And even if I did give it to you, even if I had it with me, and I just have never had a breakout, and then you all of a sudden got a breakout. The problem is that if you didn't have a breakout, why would you ever get tested?
Right.
And if doctors are instructed not to ever do it as a routine test, how would you ever know?
Pause. Why wouldn't doctors do this as a routine? Is this a money thing?
It's not a money thing. Okay. It's just a screening thing. So a good screening test is something that will reduce the morbidity and mortality. Morbidity means that when you find it, it'll actually stop it from progressing or stop you from spreading to somebody else. And mortality means it prevents you from dying from it. So good screening tests are like that. We're talking about herpes being a screening test. If 60% of the population has been exposed to herpes type 1, 20% has been exposed to type 2, if you just are randomly screening everybody for it, what you're going to have is a lot of anxiety, a lot of long-ass clinical visits where you don't have any answers for people. Then people will be freaking out. It's actually going to cause them more stress.
Yes.
And then because they're more stressed and their immune system is weak, they'll probably end up having a breakout. So it's all a fucked up circle at the end of the day. So that's why we don't screen for it. The other tests we know we can screen for, they come up positive, we can do things to prevent it from being transmitted. Like if you think about gonorrhea, you think about chlamydia, condom use, things like that. We can track down sexual partners. We can report. Most people tend to have symptoms with these things. With herpes, you may never know if you have symptoms or not. So it's really hard to tell. And if you screen everybody, it's just going to cause widespread panic. And so most places, the CDC, all these other, bodies, American Preventive Task Services Force, they don't recommend screening for herpes because it's such a common thing and it becomes such a burden. It's not even about money at all. It's just that it's a crazy common thing and it's a crazy difficult thing to counsel people on. And there are no right answers. There's no answers to it at all. Like I even remember when Usher got accused and people went crazy. And
it was insane.
It was insane how many people were talking about it. And then I actually posted on Facebook because I got so sick of all the misinformation. I broke down some medical facts. Like these are the facts.
We'll find that post.
And so we need to not jump on Usher because of this, because none of us know, but everyone had their opinions already. That post got shared something like 5,000 times. It went absolutely crazy. And then people were commenting on shit and they didn't know anything. Like someone would be like, oh, well, I've been working in a lab for 2 weeks, so I know that da-da-da-da-da-da-da-da. And then people were coming for me personally, well, this so-called doctor, quote unquote, da-da-da-da-da, how do we know if he's real? And I was like, oh my God. Social media is just can just be so crazy. I was like, because I have a degree, what are you talking about? And you're arguing with me, this is my profession.
Google me.
Yeah, Google me. So it was just kind of crazy, but I just think, for people who are watching this and people who are thinking about herpes and wondering what's going on, if you're concerned that you had rashes before or you may have been exposed to it before, ask specifically with your providers that you want to get it. Do not assume that they're screening for it. And then obviously if you have symptoms, a fever blister, a rash on your genitals, something like that, or around your anal area, or any place else in your skin. You can actually, believe it or not, get herpes in your finger.
Interesting.
It's called herpetic whitlow. It can cause a lot of swelling in the finger as well. So you just have to be careful. If you have any symptoms of a rash, especially a painful rash in your mouth or genital area, get it checked out and have a provider take a look at it and see what's going on. If you don't have any symptoms and you're just curious, ask for it specifically. But be prepared that a lot of providers may push back and say, because also they don't want to have to do all the counseling.
Absolutely.
So I can tell you the longest clinical visits I have for sexually transmitted infections, syphilis is easy. It's mostly, okay, here's your shot, you get a shot of penicillin, you're done. Gonorrhea, chlamydia, here's your shot and some pills, okay, you're done. Herpes becomes this whole long drawn out thing. And I think a lot of providers, medical providers, don't want to have that conversation because they're, not only do they not know enough about herpes probably, but they also are afraid to say, I don't know. See, I'm that motherfucker that's not afraid to say, I don't know. So as a clinician, I know that I know a lot of shit. It's my profession. I've been doing it for years. I should know. But I also know that I don't know some stuff. So when you're asking me to predict how many breakouts you're going to have, when you got it, what's going to work, what's not going to work. And they want numbers. People want numbers. Give me a percentage. Do I have a 50% chance? Do I have this percent? I can't tell you that. And I have no problem with saying that. So as long as I'm comfortable saying I don't know, and as long as you as a patient are understanding that the provider may not be able to give you all your answers, that's what you have to go in armed with. And do all the reading you want, read up about herpes as much as you want. CDC has a great section on herpes, and I'm sure there are a lot of other good websites out there. But read as much of it as you can, but realize that you're going to leave with probably a lot more questions than answers at the end of the day.
Wow.
Johnny's like, shit, I have a lot of questions now, right?
But I do want to, because we're about to wrap, but there's something I wanted to go back to because you mentioned the criminalization aspect of things. So I wanted to point out for advocates who are watching this or individuals who want to get involved in advocacy around decriminalization or modernization of our various laws. We see this coming up a lot around HIV, right?
Absolutely.
So as we are doing this work, we have to also keep in mind that the work that we're doing impacts people, impacts other things. So herpes could be in there, so where there could be other things. So just be mindful that as we are thinking about either modernizing our laws or decriminalizing these laws in our local communities, make sure that we're being mindful that we're not leaving folks behind in the way that we're approaching that work.
Right. Well,
and I think that this is kind of a perfect example of how
yeah,
that can
herpes.
sometimes happen.
Herpes is crazy. Like I said, there are a lot of good blogs and podcasts that are out there where people kind of get affirmation about it. And so I would just recommend read up, see some of these podcasts that are out there and some of the people that are claiming it. I can tell you from personal experience, and I don't mind sharing, I remember getting tested before and I'm herpes type 1 positive, but herpes type 2 negative. And so I know I've been exposed to type 1 that causes fever blisters. I think I may have had one back when I was a resident, but I hadn't had one in a long period of time. But I remember I once dated a brother who we were on like one of our initial dates and he stopped me because I was like trying to get it in at the time. And he was like, wait, we have to stop. And I was like, what's going on? He was like, I have to tell you something. He was like, you know, I have herpes type 2. I've had genital herpes before. I don't have a breakout right now, but I've taken medication, but I felt it was important to let you know.
Wow.
And I was just like, I fell in love. Like, I was like, oh my God, that's...
We can have all the sex.
Right, we can have, you can get all of it right now. But I was really impressed with that because he didn't have to tell me that. Because again, you think about how herpes operates. People can have it and never have a breakout.
Right.
But still shed it from their skin. So you don't have to tell me. And for him to actually come out and tell me that, and granted, it has less stigma than HIV, and HIV is a harder condition to disclose about. The fact that he did that with me, I was impressed, and I was very thankful about him for that. And I didn't feel uncomfortable when we did have sex. I think we did use condoms when we did have sex. The couple times we did, but I didn't feel uncomfortable even with the oral sex, the skin to skin stuff we did. I was fine with it, and so I was thankful for him telling me.
You know, thank you for sharing that story. And I think as you are watching this, if you have any comments and any thoughts, any experiences that you have around herpes, please share. Thank you so much for your amazing knowledge and the work that you do.
Doctorly today.
You are
Doctorly.
so doctory today. And listen, this is such an important topic. I'm glad we could do this on Revolutionary Health. So thank you so much for joining us. Couple of things. Make sure that you hit the subscribe button, please. And hit the thumbs up button and share this video. Let folks know that it's out there.
And join the Counter Narrative Project.
Go to our website. Make sure that you join our mailing list. Learn about everything that we have going on. Follow us on social media. On Instagram, we're at The Counter Narrative. On Facebook, we're at Counter Narrative Project. And on Twitter, we're at Building Desire. Thank you so much for joining us this evening. We will be back with Revolutionary Health. Make sure you join us next time, everybody. Bye.
Bye, y'all.